Hi, my name is Veronica Santillan, and I'm going to talk about massive splenomegaly due to disseminated infection with Mycobacterium avium intracellular. I'm a student of technical English in the University of Católica of Santiago Guayaquil. Well, the definition. Mycobacterium avium complex infections are diseases caused by two types of bacteria. Those are Mycobacterium and avium and intracellular. These do not cause symptoms in most people, they only occurs mainly in people with low immunity. The diseases that can cause a persistent fever, chronic diarrhea, emaciation syndrome, pancytopenia, and cytophagocytosis. All those symptoms can vary because they depend on the form of the disease. The most symptoms include fever, night sweats, weight loss, and fatigue. Mycobacterium avium complex, also known as MAC, is the most common disseminated bacterial disease in patients infected by the human immunodeficiency virus.
Mycobacterium avium complex, also referred to as MAC, consists of two species of bacteria. They include Mycobacterium avium and Mycobacterium intracellulare. These species, which can be difficult to differentiate, can cause disease and are found in various environmental settings across the globe. Several different syndromes are caused by Mycobacterium avium complex. For those who are immunocompromised, it can often take the form of a pulmonary pathogen. Disseminated infections are usually associated with HIV infection. In HIV-infected persons, manifestations may include night sweats, weight loss, abdominal pain, fatigue, diarrhea, and anemia. Less commonly, pulmonary disease in non-immunocompromised persons is a result of infection with MAC. According to the Centers for Disease Control and Prevention, for children, the most common syndrome is cervical lymphadenitis. This condition is defined by enlarged, tender, and inflamed lymph nodes of the neck. Although the mode of transmission is unclear, MAC is most likely environmentally acquired. According to various research, MAC has been found in freshwater, saltwater, hot water systems, soils, dusts, aerosols, foods, plants, and various types of animals. The CDC reports that the incidence of MAC in people has been decreasing due to changes in treatment for HIV-infected patients. However, antimicrobial resistance may be increasing. These are just a few things to know about Mycobacterium avium complex.
Well, applications in nursing. Pulmonary MAC infections and disseminated MAC are usually treated with a combination of antibiotics and/or anti-tuberculosis drugs and may also include antiviral drugs. In cases when there is infection associated with the AIDS virus. If in any case they do not show improvement, surgery would be recommended. Pros and cons. It is possible to find any advantage of the disease. The only favorable thing is that the patient has treatment. Cons. They can cause a strong infection for those who are immunocompromised. It can often take the form of a pulmonary pathogen. If the patient is not treated in time, he may die. issue apply in Ecuador. The Ministry of Public Health report in 2018 15,000 accumulated cases from 1984 to 2017 of MAC. 18,000 of deaths have registered in Ecuador, according to the Guide for Prevention, Diagnosis, and Treatment of Human Immunodeficiency Virus. Infection in pregnant women, children, adolescents, and adults. The treatment for MAC is azithromycin or clarithromycin or rifabutin. Conclusion: Mycobacterium avium complex, also known as MAC, is the most common disseminated bacterial disease in patients infected by the human immunodeficiency virus. This is primarily based on underlying genetic susceptibilities and cannot adequately address the complex interactions that occur between host mycobacteria and immunosuppressive lentivirus. This is a disease of which there is not much information on the internet, and at least in Ecuador it is not very common because in 13 years there have only been 15,000 cases. Thank you very much.